So today we're talking HSAs, health savings accounts, mixed with Medicare, okay? Because you got two things that really weren't meant to go together, but they can. And there's a bunch of rules, a bunch of things you kind of need to dance through. So we're going to talk about the two things. And what we're not doing today is we're not trying to convince you to start an HSA and put in a bunch of money. And if you're approaching 65 or in your 60s, it's a little late to get that started. Who we're really talking to is people that have and are participating in an HSA and they have a balance and then they're preparing to get on Medicare. We want to show them how to do that. So I want to bring Tom on and we want to talk a little bit about why we're doing this thing today.
Yes, I mean there are a lot of pitfalls with HSAs in regards to Medicare, and so if you have an HSA, we really want to do this video to just bring your attention to some of these, help you walk through sort of what you need to know and the things to avoid. And so if you have an HSA, let's continue watching, and I think this will be very helpful.
Okay, so in some ways, an HSA with a balance in it of significance is actually better than a Roth IRA. And you say, well, how can anything be better than a Roth IRA because it's tax-free? Well, a Roth IRA is not tax-free going in. I mean, you're going to put after-tax money. Whereas an HSA account, you can put up, if you're a single over 55, you can put $4,850 into an HSA. And many of you have put either that much or something short of that. And if you're a family, you can put in $8,750 in a year into this HSA. So some of you have these balances built up, and that's a tax deductible. It's an above the line deduction. Or if your employer put it in there for you, or they deducted it from your pay, they didn't take taxes out on that portion. It's going in tax deductible or pre-tax, and then it's coming out if you spend it properly on healthcare expenses without any taxes. So in some ways, it's better than a Roth IRA. And so if those of you who have a balance built up and you're coming up on Medicare, you need to walk very carefully in your decisions. And, certainly we can help you do that. I mean, I just want to bring Tom on and bring the show notes so that you can take a look at the documentation that we have backing up the stuff that's on the board.
Yeah, so we have these show notes. They're in the link below this video. They're also on our website. So pull them up. It has a lot of really good information on it. We got the picture of the board, and then really we have just a one pager that has a lot of the information you need to know about HSAs. We have the contributions. We have some of the rules around taxation, how you take it out. So if you have an HSA and you want to learn more about it, I think these show notes can be of help. One thing I'll note is that most of our viewers are over 55, but if you are under 55 or you have a child under 55, the contribution limits are a little bit lower. So just keep an eye on that.
Yeah. So what we're talking about is HSAs and Medicare. So if you've already got a balance in there and you're coming into Medicare, we're going to talk about in a sec, you need to stop contributing to it if you have any part of Medicare. But what I want to assuming that you've done that and you get on Medicare, what I want to show you is what you can actually do with that money is you can pull money out in tax-free distributions for medical expenses. And this is going to include long-term care insurance premiums. So if you purchase long-term care and it's qualified long-term care, or even some of the hybrids that we have, the rider on them is a qualified long-term care expense. So it's possible to take money out of this thing tax-free to pay long-term care. You can pay your Part B and Part D of Medicare. So, and that you can pull that out, pay it out of there. And then you can't pay for Medigap insurance. Can't do it. It won't allow you to pay for health insurance, but it's also going to pay for any, deductibles, over-the-counter medicines. If you're having some type of medical expense that's not reimbursed by Medicare, but yet it's qualified under massages. If they're through the right type of practitioner, maybe not covered by Medicare, but yet it's still a qualified medical expense. You can pay for that. So there's a way over your retirement, if you have a balance, to just pull that money out year by year and use it to pay expenses, that medical expenses that you're incurring anyhow. That's the smart way to distribute it.
I do want to make one point here too, is that on the Medicare premiums, so you're able to pay for Part B premiums out of the HSA. So I'm really talking to people that potentially have an IRMA issue where they have a high bill for Medicare. You can cover the Medicare normal Part B premium and the excess charge, the IRMA expense, out of the HSA. So that's something that I would encourage people that have these balances and you're facing IRMA, go ahead and pay the IRMA with the HSA.
Okay, great point. Now, this is the place that people get into trouble, is they're on a high deductible health plan through their work, and then they come up on 65 and they don't sign up for Medicare Part B because they don't want to pay the premium, but they sign up for Medicare Part A, but yet they keep working and they keep contributing to their HSA. And so if you've got any part of Medicare and you're contributing to your HSA, you're violating a bunch of rules. Okay. And I don't really want to get into like how we fix that, but we can fix those things. But it's a little complicated and there's some penalties involved and some taxes that have to be paid. So if you're turning 65 or you've already turned 65, you're still working or your spouse is still working, you're still covered under the group insurance, and you have an HSA account, don't even sign up for Medicare Part A, even though it's free. And frankly, I don't see people get a lot out of their Part A when it goes with group insurance anyhow. So you're not giving up a whole bunch. Just be careful that you don't sign up for the free part of Medicare, which is Part A, and keep working, keep group insurance, and contribute to an HSA. That's something you want to avoid. Then we talk about late signups. So if you're one of those people that does that, and now you're 67 years old, now you're ready to retire, and perhaps your spouse is over 65, but maybe a little bit younger, you've both been relying on the group insurance, you've both been contributing to the HSA, and now you sign up for Medicare. What Medicare is going to do is they're going to backdate your Part A 6 months. It's just a kind of a weird thing that Medicare does. They're going to backdate your Part A, and then they're going to start your Part B at a current date. So if you're one of these people that's delaying Medicare, not participating, you're going to use your group insurance to prove creditable coverage. We can help you do all of this. And then on your retirement date, you're going to start Medicare. What Medicare is going to do is they're going to backdate your Part A 6 months, or not any prior to 65, but if you're 67, in my example, you're going to get Part A 6 months ago. And if you do that, you're going to, if you contributed to the HSA during that 6 months, that creates a problem. So if you're in this situation, just give us a call. We're in all 50 states and DC. We do stuff by Zoom. It just feels like the people are right across the kitchen table.
On that note, with delaying Part A and Part B of Medicare, and you can still contribute to an HSA. I will often get questions where people will try to game the system, say, well, why don't I just make the full contribution into the HSA in the beginning of the year and then sign up for Medicare later in the year and then I'm okay. Well, that's not going to work. They're going to prorate the amount of months that you were on Medicare or not on Medicare, that you're still eligible for the HSA. That's, let's say you sign up and Medicare starts in June or July of that year. You can make half a year contribution to the HSA or half the maximum. So if we're taking 4850, divide that by 2, that's the amount that you can put into the HSA. It's not the full year. So it's prorated for the amount of months that you're eligible to contribute. And so some people get in trouble here because they delay, say they make the contribution for, I'll just say 2022. They made a full contribution for 2022. They retire January of 2023, sign up for Medicare thinking they're fine. Well, now their Part A has gone 6 months. So their Part A actually started in 2022. They already made the contribution. Now they have over contributed to the HSA and we got to fix it. So again, the video today isn't about how to fix it. Just know it could potentially cause a problem. So you just want to be mindful of that looking forward. If you have an inclination of when you're going to retire, you might want to hold back on the contribution from the previous year, just depending on how the dates work out.
Okay, thank you, John. Now, let's talk about the penalties that the IRS, because the IRS, they don't want you sticking money into an HSA and then just pulling it out and spending it at any time. So they've made a serious problem. So if you retire, you've been building up this money, you didn't spend all of it, you got a good balance in there, and then you just say, I'm just going to take the money. Well, make sure you're over 65, because if you do this before 65, or let's just say you were 60 and you got laid off from your job and you just needed the money, they're going to hit you with the taxes due, which will probably be in the 30% department, plus a 20% penalty. So half the money is going to go back to the government. So you really don't want to do that. But you especially don't want to do it before 65. Now, if you wait till after you're 65 and you just got to have this money, then you're going to lose the tax-free piece of it. You're just going to have to pay the taxes. It's going to be like an IRA distribution, a pre-tax IRA distribution. You just have to pay the taxes. And some people, if they're very much in need, are going to do that. But we really want to avoid that if at all possible. What we want to do is take what you have accumulated at Medicare, let it sit there, let it grow, and then just start chipping away at it through eligible expenses, which you are going to incur once you're on Medicare. Okay. Now, the distribution for any medical expense, qualified medical expense, is tax-free. Now let's talk about death. Is what happens when somebody that has an HSA dies. Okay, there's a beneficiary on there, and if it's the spouse can still use the amount in the HSA for the rest of their life, pull it out and pay for medical expenses, just like it was theirs. So that's the first thing. But if it's other than the spouse, if it's left to the kids or somebody that is not the spouse, then you're not going to have a penalty, but you're going to have to draw it out if it was somebody else's and you're the beneficiary, and pay the tax. So I want to bring Tom back on for a few last comments.
I think one more point on that 6 month where they'll backdate Part A 6 months is they're going to backdate it 6 months or to your age 65. So let's say you sign up at 65 and 4 months. They don't go back 6 months from there because the earliest you're eligible for under normal circumstances is age 65. So I've had people get confused on that. So the 6 month backdate only applies if you're past 6 months prior or past age 65. So just know that. And if you have questions on that, just call us, because there's a lot of moving parts here. It can get somewhat confusing. So just call us. We'll help walk you through it and just sort of let you know when you need to be careful about contributing to these.
So this whole video is about tax, because an HSA is really, why would you need a separate savings account for your healthcare expenses if it wasn't for tax? And the answer is you wouldn't. You could just save money in your regular way of savings, and then when you got medical expenses, you just pay it. So this thing is all about tax and tax planning, because if you've got a balance in there, you haven't ever paid taxes on that money. And if you pull it out for medical expenses, you're never going to pay tax on that money. So it's a nice retirement benefit that you've created for yourself. We talked a little bit about estate planning and beneficiaries, and then that's pretty much it. It's HSAs and Medicare, and how do the two work together. So I want to bring Tom back on. I'm Hans Scheil.
And I'm Tom Griffith.
And we thank you very much for listening.
Thank you.